So there were two survivorship abstracts that I thought were interesting. One actually showed that primary care physicians are not routinely being involved in the patient survivorship care planning. And unfortunately, what the researchers found is that patients then did not have as coordinated care as they could have or would be ideal, and costs of care were increased. So if the primary care physician is not on board with what is the most appropriate follow-up for a patient, or what tests need to be ordered, or who's ordering the tests. Patients may get multiple tests ordered, they may be getting tests and imaging that are just not necessary. So as cancer physicians, we really need to do a better job working with our primary care colleagues to make sure that the patient's care is coordinated after the active treatment ends. There was another study where in the social media community, the breast cancer social media community, we actually surveyed members, participants in the BCSM tweet chats, and asked them, did you receive a survivorship care plan? What format was it in, electronic versus paper? And was it complete? And what we found is that the majority of patients did not receive a survivorship care plan. Those that did, it was not in a format that they preferred. The majority preferred electronic. Now that might be biased because these were patients who were actively participating in a Twitter chat. And the survivorship care plans weren't complete. What we know from prior studies looking at the social media community, they're primarily well-educated, white, higher socioeconomic status patients. And this study was no exception. So these patients who should have, in theory, the best of the best, because these are the most privileged, if you will, among healthcare recipients, we were not meeting their needs, and we were not meeting national standards in terms of providing survivorship care plans. So I think the other message is when we start looking at ethnic minorities and those of lower socioeconomic status, are we even scratching the surface in terms of where we need to be in terms of the survivorship information?